You may still eat normally, walk every morning, and believe you're in good health. But one day, you notice a strange numbness in your feet, blurred vision, or a small cut that just won't heal. You go for a checkup and hear what so many others have heard. You have diabetes. It may not come as a shock, but it hits you like a quiet wave of fear. Because from this moment on, your life is no longer the same. Diabetes is a very particular kind of illness. It doesn't strike suddenly. It doesn't cripple you overnight. It doesn't scream for your attention. Instead, it creeps quietly, slowly, and relentlessly through your body, damaging blood vessels, nerves, and organs as it goes. Especially after the age of 50, diabetes becomes a shadow many carry without knowing. A silent companion that waits for a moment of weakness, of carelessness to strike. Many people think of diabetes as simply high blood sugar, something you can fix by avoiding sweets. But in truth, it's much more complex. It's a systemic metabolic disorder that gradually affects your vision, kidneys, heart, brain, and more. The dangerous part is, this process happens slowly. So slowly that many people only discover they have diabetes once complications have already started, when vision is blurred, the kidneys are weakened, or wounds refuse to heal. Here's a fact that should make anyone pause. Many people with diabetes don't even know they have it. In its early stages, type 2 diabetes has almost no obvious symptoms. You might feel thirstier than usual, urinate more at night, lose a little weight, or feel unusually tired after meals, but these are things most people brush off, especially as they age. It's just getting older, they say. And so, they wait. And in that waiting, the disease grows stronger. If you're over 50, or you have a loved one in that age range, you should know that some signs of diabetes only appear once internal damage is already done. If ignored, it can quietly rob you of your independence, your energy, even your memory. Type 2 diabetes is by far the most common form in older adults. Your body still produces insulin, the hormone that helps control blood sugar, but it becomes resistant to its effects. That means sugar from your food stays in the bloodstream, instead of being absorbed into your cells for energy. This excess sugar acts like a mild acid, slowly corroding blood vessels and harming vital organs over time. You might be surprised to learn that diabetes is the leading cause of blindness in adults. It's a major cause of kidney failure. It leads to foot ulcers, sometimes resulting in amputation. It significantly increases your risk of stroke and heart attack, and yet many people continue to underestimate it, thinking that as long as they avoid desserts, they're safe. So how can you catch it early? Start by listening to your body. If you're often thirsty, urinating frequently, especially at night, losing weight without trying, feeling unusually tired despite sleeping well, or experiencing numbness in your hands or feet, don't ignore it. These could be the early signs of rising blood sugar. But the most reliable way to know is to get tested. A fasting blood sugar test or an HbA1c test can give you a clear picture. If you're over 50, overweight, inactive, or have a family history of diabetes, get checked every 3 months. Don't wait until your body starts breaking down to take action. You might say, but I don't eat sugar. The truth is, diabetes isn't just caused by refined sugar. It also comes from white rice, bread, sugary fruits, processed food, soda, and even chronic stress. Yes, stress can trigger insulin resistance and blood sugar spikes. The good news is, you don't have to follow an extreme diet to control diabetes. Small, consistent changes can make a big difference. Start with what you eat. Reduce simple carbs like white rice and pastries. Eat more vegetables, lean proteins, fish, and whole grains. Choose fresh, unprocessed foods whenever possible. Drink water instead of sweetened beverages. Eat at regular times and avoid heavy late-night meals. Next, move your body. You don't need a gym or intense workouts. A brisk 30-minute walk, light cycling, yoga, or gentle stretching can improve insulin sensitivity and help your body use up excess sugar more efficiently. Then, look at how you sleep and manage stress. Chronic stress raises cortisol, a hormone that interferes with blood sugar control. Make time to relax, practice breathing exercises, meditate, garden, talk with friends. Whatever helps you stay calm and centered. If your doctor prescribes medication, take it as directed. Don't skip doses just because you feel fine. Diabetes is a long journey, not a short battle. You need discipline, knowledge, and the courage to keep going, day by day. You can't change the fact that you're aging, but you can absolutely choose how you age, with awareness, with strength, and with the power to protect your own health. Diabetes isn't a death sentence. It's a wake-up call. It's a reminder to stop coasting through life and start paying attention to what your body needs. In our next episode, we'll explore one of the most feared changes in old age: memory loss. Is it just a normal part of aging, or a sign of something more serious, like dementia? And what can you do now to keep your brain sharp and focused as the years go by? Stay tuned, and remember, it's never too late to take control.